there, this is Steve Lynch, LMT, licensed massage therapist, and I'm chatting you up here live from Limestone Therapeutic Massage in beautiful Newark, Delaware. Hi, the reason I'm chatting you up today is I want to talk about the shoulder for a couple of minutes. And I want to talk about the shoulder in relation to design, function, and relative to getting the best out of it and avoiding complications and eventual surgery. And if that happens to be the case, what to do about it, post-surgery, to optimize your recovery. So let's talk about the shoulder for a minute in relation to structure. We have what's called a shoulder girdle, and that's going to involve specific bone structure, musculoskeletal structure, clavicle, acromioclavicular joint, glenohumeral joint. You're going to have muscle and connective tissue that surrounds it. And you can think about the shoulder joint like this. And all you machine heads out there, you know what I'm talking about. Bearings and races. Okay? Machine heads are going to know what that is, and other people will, but a bearing generally can be spherically shaped, round, and it travels in and around what's called a race. A race is a surrounding composition of other bearings which allow it to float and to spin freely. You can actually spin it around, and that's a beautiful thing. Optimal design for structure. The shoulder is very much like that, with the exception that this particular bearing has a nice long shaft on one end of it. And the hitch here, and it's a real hitch, no pun intended, or maybe there is one, is that all of the muscle and connective tissue and fascia that connects to and from this joint that has this shafted bearing, they all have absolute control, manipulative ability as to how this bearing articulates inside this race. So let's cut to the chase here. What does that really mean? Well, let's say that you injure a shoulder muscle, like maybe it could be a deltoid, it could be on the scapula, whatever it might be. It's going to have some constrictive results relative to how the bearing moves inside the race, how the shoulder joint works, and the ability of that shoulder to move. And it's important to do a couple of things, beyond RICE, rest, ice, compression, elevation, those types of things. Heat and ice are very, very beautiful for all those types of injuries. And after that, there's going to be the need to stretch this out, to alleviate potential sticking points, potential adhesions between the connective tissue, the fascia, and the muscle and the tendon. Because if you don't, what's going to happen is the inflammation is going to be perpetuated. You're going to have a ripping and tearing situation, and eventually there can become arthritic symptoms, signs and symptoms in the shoulder joint, such as bursitis, eventual bursitis. Bursitis is a condition in and of itself related to the shoulder, but we're talking about some things which are treatable other than bursitis, and that's really just musculoskeletal challenges which will eventually lead to things like bursitis or the uneven wearing of the crown of the humerus bone, which goes into the glenohumeral joint. So a good clinical, medical, orthopedic, massage therapist or neuromuscular therapist can actually get in there and strip off yellow collagen fiber, break up adhesions, separate fascia from muscle tissue, and restore the normal function of this particular shoulder joint and alleviate the need for surgery. Surgery should always be the last resort. Now, certainly there are some situations where surgery is warranted after years of neglect and abuse. And, hey, if it ends up that way, you just have to bite the bullet and go and get repaired. However, after we're talking post-surgical, there's still hope for a lot of great recovery in shoulder movement and ability. Number one, you're going to follow the PT's advice, which most people don't. They follow it for a couple of weeks, and when they feel like they can kind of move their shoulder a little bit, they quit doing the exercises, they quit doing the rehabilitative practice, and they slump back into a condition of non-functionality or less than optimal, and then they just kind of gimp along and live with that. Doesn't have to be that way. Again, even post-surgery, your clinical therapist, your orthopedic or medical massage therapist, or your neuromuscular therapist can alleviate those same conditions, can get rid of scar tissue, can optimize your recovery functionality. I like that, recovery functionality. Functionality is a great word. It means that it's working properly. And so if we want to sum up in a nutshell what I'm talking about, the human body, including the shoulder, is a very mechanical thing, and it kind of takes people with mechanical aptitudes and attitudes to be able to help it function optimally. Just like any other thing, any other machine, like your car or whatever it might be. You take your car to a top-notch mechanic, going to know just what's wrong with it. They're going to know just what to do and how to treat it, and you're going to drive it out there. It's just going to be just like great. All the problem solved. Our body is very much like that. It is, although organic, it is probably one of the most complex machines on earth. And that's right, I said machine. And it takes technicians to properly repair and maintain this beautiful machine. So in closing, let me say that go see a clinical or an orthopedic medical massage therapist, a neuromuscular therapist. You can find them at the orthopod shops. You can find them at the chiropractor's offices. And there are even clinics like here at Limestone Therapeutic Massage where people that have those skill sets are very valued. Go check them out. If you got some injuries in your shoulders or any other joint structure, your back, we're worth the shot, and we can help you avoid those surgeries. And if you do have them, we can definitely help return functionality to your body. So again, this is Steve Lynch, LMT, licensed massage therapist. If you have any questions, please hit me up at steveLynchLMT.com or limestonemassagetherapy.com or .biz. All right, have a sweet life.